talk about a particular medication that I've been taking, and I've been taking it for quite some time, Metformin. So I went to a different doctor for the gastro issue when we did the endoscopy. He asked why I was taking Metformin. So I want you to explain what Metformin is and what are the benefits for someone like me to take Metformin.
So in general, Metformin is one of the best diabetes medications, and still, as of today, it's the number one medication to treat diabetes and type 2 diabetes specifically. And also, it's a medication that can be used in pre-diabetics to help to slow down the progression of diabetes. But actually, interestingly, I want everybody to Google Metformin and cancer prevention, and you're going to be shocked how many studies have shown benefit of Metformin reducing all types of cancers. Not specifically kidney cancer, liver cancer, whatever. So apparently there was some study that was done at some point that looked at tens of thousands of patients on Metformin versus a control group in the population, and they found that the incidence of cancer in that group was significantly less. So Metformin does have an anti-cancer properties. Again, we don't put every person on it, but if somebody has some changes in their glucose, somebody trying to control their weight, their appetite, in women that have a condition called PCOS, Metformin is one of the best medications that treats these women and improve the regulation of the hormones, their periods, and most of these women get dumped in birth control pills, even if they're not attempting birth control, just for the idea is to regulate their period. Actually, most of them, if they're given proper amounts of Metformin, it balances their hormones and brings their period back. Going back, to your condition, while you're trying to diet and trying to control your weight, trying to do whatever the best you can to reduce risk of disease as you progress in life, that one of the things that are recommended is Metformin. Metformin, if you're not diabetic, is not going to drop your sugar or make you collapse with low sugar or hypoglycemia. That doesn't happen. There's a lot of doctors that are still afraid of Metformin for a very ridiculous thing that has been linked with Metformin that the FDA should act on as of today and change this nonsense. There is a parent drug before Metformin that had increased incidence of a condition called metabolic acidosis or lactic acidosis, a subform of metabolic acidosis. The incidence of that condition in Metformin is so ridiculously low that it's not even worth talking about it. And if it ever happened in Metformin in the last 20 something years that I've been in this country, I think Metformin came to this country the same year I came. Me and Metformin came to the United States in 1994. So I think I remember the date very well. So Metformin has been here for 26 years, and the incidence of that lactic acidosis is negligible in the millions and millions of patients have taken it. But still, people are so worried, let's check about make sure, the people don't get lactic acidosis. I've used Metformin way out of the scope that was recommended, and 10, 15 years later, actually what I was doing proved right. I used it in patients with chronic kidney disease, stage 3, stage 4, etc. It was contraindicated for years in those groups. Why? For the fear of the lactic acidosis. And that really, through the last 3, 4, 5 years, what I was doing proved right. And it's, again, I'm not doing things as a cowboy or whatever. I was observing and look at the data, the literature, etc. There was no suggestion. And Metformin was used in Europe for many years before coming to America. So it was not like a new drug we're testing. So the story of the lactic acidosis scared people out of an excellent medication unnecessarily, which can be used, for diabetes prevention. It's always used in diabetes treatment, type 2 diabetes as a first line. But also I think it's underused in looking into the cancer prevention part of it. And a lot of patients tolerate Metformin when it's given properly and introduced slowly. Because you cannot take a patient and give them full dose Metformin and make them have severe nausea, vomiting, diarrhea and say Metformin causes side effects. Yes, Metformin has to be introduced slowly, a small amount titrated every week or every 2 weeks, depends on patient to patient, to whatever goal the doctor decides is necessary for them. And it's an excellent medicine to tolerate. As I said, you can use it for appetite control, weight control, diabetes prevention if there's a strong family history of diabetes, or if there's change in the person's glucose, or even for reducing risk of cancer.
Right.